Hello everyone, welcome to Raaonline, and today's topic is about respiratory system. So respiratory system means two groups of drugs will come to our mind. The one major one is drugs which are used in bronchial asthma, and the second group is drugs which are used in cough. So these are the two groups we used to study in respiratory system. So first we are going to see about drugs which are useful in bronchial asthma as well as in COPD. COPD is chronic obstructive pulmonary disorder. It's a group of disorder, especially occurs in smokers as well as people who come across with air pollution, and mainly deals with emphysema as well as alveolar distraction. So about the diseases, the types of drugs used in that, the mechanism of the drugs, and what are the devices we use for giving these asthmatic drugs. So everything we are going to see in this PowerPoint. So first we are going to see about the drugs which are used in bronchial asthma. Then the different groups of drugs like methylxanthines and beta-2 agonists, mast cell stabilizers, steroids and anticholinergics. The role of these drugs in bronchial asthma and about their mechanism of action, their uses as well as unwanted effects we are going to discuss in this PowerPoint. Other than that, certain group of drugs which are used in status asthmaticus. Status asthmaticus is an emergency condition of bronchial asthma. So about the drugs, the management of status asthmaticus also we are going to discuss in this PowerPoint. To understand, the first thing is bronchial asthma. What is asthma? It's a chronic inflammatory disorder of the airways that really causes, or the main symptoms of this are episodes of wheezing, breathlessness, chest tightness, cough, and particularly which occurs in the night or in the early morning. So bronchial asthma means mainly because of these conditions. Bronchoconstriction, constriction of bronchi, bronchioles, mainly because of that airway obstruction takes place, and tightness in the chest occurs, and followed by hyperreactivity, hyperresponsiveness. You can see if a patient gets asthmatic attack means immediately again and again it is hyperresponsive. He will be getting again and again. So hyperreactivity, and the third one is inflammation. All these things occurs, bronchospasm as well as hyperreactivity. The main reason, underlying reason for that is bronchial inflammation. The mediators, anti-inflammatory, that is the inflammatory mediators which produces excess secretion and mucus in our lungs. That is the reason for producing bronchoconstriction as well as hyperreactivity. So asthma, the symptoms means you can see breathlessness, chest tightness, cough as well as wheezing. Why that wheezing occurs? Wheezing sound occurs. So you can see in a closed window, if you are leaving a small opening means if air is passing through the window, it will produce as a sound, a wheezing sound. So air is finding its way difficult to inhale as well as getting exhaled from our body. So mainly because of that it produces a sound. That sound is called as wheezing. So these are the symptoms of bronchial asthma. So what happens in this bronchial asthma? The pathogenesis. So this is a outline of this pathology of bronchial asthma. So the inflammation as well as airway hyperresponsiveness. These are the main reasons we have seen. Why it occurs? Mainly due to allergens or sensitizers, virus, air pollutants or cold or sulfur dioxide, anything, mainly because of that may lead to release of inflammatory mediators. So that leads to airway hyperresponsiveness. So it produces the symptoms cough, wheeze, chest tightness as well as dyspnea. This airway hyperresponsiveness can be stimulated by, these are the triggering agents, allergens, exercise, cold air, sulfur dioxide, some particulate matters, pollution. So these can stimulate airway hyperresponsiveness. The same factors can stimulate inflammation. These two are the major reasons which produces these symptoms. So in detail we can see the pathogenesis. So what is happening in the bronchial asthma? If any pollutant or allergen or anything reacts with our body, it just breaks down our mast cells. The mast cells which are present in our body, especially in the lungs, they release excess of mediators. So within seconds it will release certain mediators like histamines, tumor necrosis factors like certain mediators are released in minute. Certain mediators like cytokines, platelet activating factors, certain substances, certain mediators are released in minutes, and it takes hours to release certain mediators like cytokines and certain leukotrienes, so eosinophils. These things can be released after taking some time. So if mast cell degradation occurs means in different phases, in seconds certain mediators are released that produces allergy, followed by in minutes certain mediators are released that produces hyperresponsiveness, hyperreactivity, and that inflammation is increased by releasing late mediators, and because of that the bronchial asthma is a continuing process. It is a perennial process which mainly occurs due to the release of mediators as well as inflammation. So you can see, because of any allergen or any extra stimulus, the mast cell will get degraded and it will produces this leukotrienes, chemotaxins, chemokines, these substances. So they produces bronchospasms. So because of release of leukotrienes and chemotaxins and chemokines, these substances, they produces bronchospasms. So after some time, in the late phase, after minutes, after hours, some other mediators like platelet activating factors, tumor necrosis factors, these substances are released, and some types of mediators, even cystic leukotrienes, these substances are released. So mainly because of that epithelial damage occurs that will lead to airway inflammation as well as airway hyperreactivity. So these things, they produces the bronchospasm, wheezing as well as coughing. That means this condition is extended or maintained mainly because of the continuous release of mediators. So this is the main pathology of bronchial asthma. Mast cell degradation occurs, release of mediators occurs, that produces bronchospasm. That bronchospasm, bronchoconstriction, that inflammation, hyperresponsiveness is maintained by release of continuous release of mediators. After some hours it is produced, and mainly because of that the inflammation as well as hyperreactivity is maintained, and that leads to bronchospasm, wheezing, coughing, dyspnea, all these symptoms. So this is the pathology of bronchial asthma. So by understanding this pathogenesis, we can easily understand about the drugs which are useful in